Hello, my name is Dr. Scott Young, and today we're going to talk a little bit about insurance processing. Coming right up. So insurance processing is a big thing when we're at hearing solution centers. So we've talked a little bit about when a patient comes in and they've called up for their appointment.
Yes.
So I want to talk a little bit about the process that we go through to verify what your insurance can actually do. So can you talk a little bit about that after they filled out the paperwork, the basic paperwork kind of thing?
Right. Yes, so every insurance plan, it can be different. There are lots of insurance plans out there.
Yeah.
That's the fun part.
Yeah.
You never know.
Right.
So what happens is I will take a copy of your card and put it into the system, and then call and get your exact insurance benefits. And that is something that we've got like a set list of questions that we ask. And
there are like 30 different questions on that too.
Yes, there are multiple different questions. And also, depending on the insurance company, you're not going to get through to an insurance person right away. You're going to go through a very long process of automated questions that have nothing to do with hearing aids.
Yeah.
At all.
Exactly.
You're just entering information and getting information back that you really don't need until you get to the place where you finally can get an agent on the phone.
So, tell me a little bit about the difference between, what a patient could call up and ask, do I have, XYZ benefit? We're talking about hearing, but
Right.
they call up and they think that they got a hearing aid benefit. Mm-hmm. But what do you do differently when you're asking those questions?
It really is all about the questions, because we ask the exact questions that give us the exact details that we need to know and you need to know to get your exact benefit. Because they might say, oh, you've got this X amount of money, but it depends on so many different things. How much coverage you have in that benefit. Is it 80%? Is it 60%? Does your deductible apply? Does your out-of-pocket apply? I mean, there's so many questions.
And are we in network with that?
Are we in network? Contracted rate. I mean,
Exactly.
there's so many different aspects to it.
And I think one of the things that it's been a hallmark of something that I wanted us to do, and over the 32 years, we've called, I've had places that I've worked for or places that I've had, and you call on insurances and you get these crazy numbers. And I've seen people, and I know you've dealt with this too because you've had some hospital visits in your past too with that.
Right.
And you get these surprise things, right? The surprise, holy cow, it's a
Yes.
$5,000, $6,000, $7,000 out of pocket. And it creates a panic.
Mm-hmm.
In me and Emliee, just personally, from all the stuff that I've been through a dozen different surgeries, and I had one a year and a half ago. I was in a hospital for 3.5 days and I nearly died. The bill was $142,000, and I wanted to puke. It was right by the trash can. I wanted to puke right into it, and then I looked at the thing and I realized, oh wait, $25,000 was the cut down number, right? The write-off number,
Right.
and they had paid $23,500 kind of thing, or something to that effect. And I think that's the key that you do when you're looking at that, right? So you're kind
Right.
of cornering them in.
Yeah, and we want to get, an exact number, because yes, we do the insurance verification, see all the coverage, but we take those numbers and we get the exact number that they'll cover. That way we can get the best possible price-wise, for our patients, because we want to utilize all of the insurance benefit.
Yeah, in a correct way, because there's people want us to fudge it a little bit. You can't fudge that stuff.
No,
okay?
no.
Because we have to deal with that same insurance over and over and over again. So we want to be in compliance and in that overall compliance, but we have to know that level of this. I think about it like a tax accountant. You can go on the super conservative, super scared mode, or you can go up to that point. Now, that's the same thing that happens, and we have to know what the insurances are.
Right.
And I think so the first step is to do that, but guess what? There's something fascinating on the bottom of the form. It has their name and their reference number. What does the reference number mean to you?
It means that whatever they say on that call, whatever they told me was their benefit, If we bill and something completely different comes back, we can say, wait, hold on.
Yeah.
This is what we were told by you guys.
On this
With
date,
on this date,
right.
this person, this reference number, pull it up just like that.
We're hog tying them.
Yeah.
In essence, in that way to that point.
Mm-hmm.
So then what happens, let's say a patient might have an 80% benefit on a set of hearing aids, and then they know what that number is on the back end, right? And then we get this thing called an EOB. You know, so talk to me, I mean, how many weeks down the road is that? What happens when we get that EOB kind of thing?
Kind of it's an explanation of
Right,
benefits
yeah.
is what it is. And it can be a while before we get that back.
6-8 weeks, you know, maybe 2 to 3 months, you know,
right.
as much
That
as.
can be payment, and it was spot on. Everything's great, smooth
Yeah.
sailing.
Yeah.
Sometimes completely wrong.
Yeah.
And then we've got to resubmit, rebill, figure it out, call them, work out the problem.
Right.
So there's a lot on the back end when it comes to the insurance stuff of processing those.
And we actually even have an insurance processing company called Rapid Care Insurance Rapid Care Solutions, and we love them because they actually know how to be on our OMS system to find out what's happening. We are billing, you know, the audiologists are billing, but all of us have to interact to make sure that we kind of get the monies that we need for you with that too. So when the EOB comes back, what happens when the EOB comes back and they paid more?
With overpayments, we credit that back to the patient.
Right.
We send a check back to the patient. Like just yesterday, we
Yesterday.
sent back over.
Was it 500 or
I think
something?
it was $500 and something
Yeah.
back because the insurance just happened to pay an extra $500. So we credit that back to you. That's
And
yours.
so we want to do that because what happens there is lots of people, you know, they look at the money and they think, you know, you're just going to take it from me in one way or another. I don't want to take it from you. If we told you, you know, they're going to pay X, you're going to pay X, you know, or Y over here, but there's a Z amount that happens between it, right?
Mm-hmm.
And they happen to pay more, and we, again, like we just had one, they paid like $500 more. I'm gonna write a check and say, listen, now here's one of the things that happens. We'll write the check and say, no, the insurance could come back within a year and, you know, make a determination difference on that, which happens every once in a while. But normally, because we've done the basic work, it doesn't become a problem with that.
Right.
So I think that's a really big part for you, and we don't charge you anything extra by doing that. It's part of what we want to have, and it's that transparency,
Right.
right? So think about like a glass, and you want to be able to see through it and not just guess.
Right.
And see when you call on it, and we want to be your advocate in that way. You have no idea how much we'll fight with people on the phone.
Yep.
You know, and this is what we do, and we also pay Rapid Care Solutions to do that as well. So it's a full prong, you know, full on attack to get all that stuff done for you, but you get the benefit on the back end with that too. So I think that's something that we wanted to share with you and give you some of that understanding. But if you like what we said here, subscribe to us. You can come see us at Hearing Solution Centers or heartulsa.com. Thank you so much.